Test, test, 1, 2, 3. Test, test, 1, 2, 3. Test, test, 1, 2, 3. Test, test, 3, 2, 1.
of the Tarrant County Hospital District is now called to order. Welcome to all of you who are participating. I'm pleased that we are now able to meet by means of electronic participation, thanks to the emergency orders of Governor Greg Abbott and Attorney General Ken Paxton, dated the 16th day of March, 2020, which have temporarily suspended certain requirements and provisions of the Texas Open Meetings Act. Though we are not able to physically meet at the boardroom, board members are participating today by video conference using WebEx web conferencing application. This is our second meeting by web conferencing. So I'm asking all of us board members, JPS staff, and general counsel for Tarrant County Hospital District to be patient and to do our best to make this meeting as smooth and effective as can be. And now I have to call the roll, no particular order. Zim?
Here.
Steve Simmons? Here. Trent? He's gone. Steve Montgomery?
Here, sir. Here.
DT? Hello, DT.
Yeah. Hi.
Okay. Reverend? I thought I heard him.
He's muted.
David, are you going to take care of that?
There he is.
Reverend Ralph Waldo Emerson.
Yes, sir.
All right.
Can you hear me?
You got it. Amanda.
Here.
Okay. Charlie Powell.
Here, Chuck.
Roger Fisher.
Present.
Dorothy.
Present.
Here.
Okay. We had some ground rules. Any board member or staff member wishing to speak will just need to let me know by use of WebEx or text to my cell phone. But everybody was pretty respectful last time, so we're not going to have to do it that way. Just people speak as they need to speak. When a motion is appropriate, a member of the board who wishes to make a motion will need to wait until I recognize you and make the motion. Same procedure will hold for a second. And then the chair, it says we'll call on each board member one at a time for a vote, but if it's okay with you, we'll do it like last time, which will be just ask for the negative votes instead of going around the room. Is that all right with everybody?
Yeah.
Okay. And we'll proceed to order of business as on the agenda. So like for prayer, Leanne.
Thank you. Good afternoon, everyone. As we begin in prayer, the words of an old hymn keep coming to my mind. So I'm going to start with those words. Let us pray. Grant us wisdom, grant us courage for the facing of this hour. And this is what we ask, dear God. Please lead us, guide us, direct us, equip us to make the best decisions as we navigate this very challenging time. We're so thankful for every board member, every leader, every JPS team member. Please keep us all safe, keep us strong, so that together we can come through this better, wiser, and stronger than ever. In your holy name we pray. Amen.
Amen.
Amen. Pledge of allegiance, for those that can see it. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
With liberty and justice for all.
All righty, to the agenda. There were no citizens that signed up to address the board. The next is approval of the minutes. Everything was circulated on the board portal ahead of time, I believe. So if those look okay, I'll entertain a motion to approve them.
Move approval of the minutes.
Dorothy approved first.
Mr. Chairman,
Yes.
I believe we need to look at the language that was used regarding the legal services. that I believe Reverend Emerson moved approval and Dorothy seconded on. Going back and watching the motion, I'm not sure that is in line with the spirit of our discussion on the topic.
I'm trying to find out where you are here, Roger.
Are we approving the minutes of the April 7th meeting?
April 9th, yeah.
Or the April 9th?
Yeah, April 9th.
The motion regarding legal services was made, Chairman Weber, you asked for a motion to accept the report of Regina Montoya with implementation after 30 days. That was moved by Reverend Emerson and seconded by Dorothy. I'm not sure, though, that the motion reflects the discussion that we had regarding the topic in closed session.
Well, I'm still trying to find where you are in the minutes from last. Oh, I got it. Well, what would you have that say? That's what we did, Roger.
I don't know. My only question is that, I mean, if that's in line with the spirit of what we discussed, I don't think it is. And I don't know how some of that discussion was done in closed session, so I don't know how we talk about it here at this point. If the motioner and seconder agree that is indeed what they're looking for, then that's fine. If not, we should have the minutes reflect the expectations of what we discussed.
What?
Can someone identify what page we're on in the minutes? I can't find that, sorry.
19 out of 347 in the board book, but not the iPad.
It's item 13B in the minutes.
Because I think the summary is appropriate, and I think the action that we took is accurately reflected there.
Mr. Chairman, this is
Yes.
Zim. I think the issue probably is better stated that by the motion that was made, we're supposed to have already acted on that, and we haven't, and we're probably not gonna for a while. So I think that's what Roger's trying to get across, is that it reflects something that we haven't done and can't do.
But that is that not an accurate reflection of what we voted on the 9th of April?
Yes, sir, I believe it is, and it's probably the motion can probably stand, but we're going to have to come up with a class of action, because right now we're challenged, or we're tasked with doing something in 30 days, and 30 days has passed and no action has been taken. So we're going to have to revisit it.
Yeah, and there is obviously we're going to go and revisit it. There's still a lot of discussion to be had, I believe. But what's on the table is a motion to approve the minutes, and I'm looking for a second and a vote, if I may. So if there's no second, then we're not.
I'll second the motion to approve. I'm just trying to clarify what the discrepancy in that is.
Chuck, can I say what I thought? We were approving the plan, but I did not believe that we were going to be implementing that plan in 30 days, because I don't believe in that plan there are some things that we needed to clarify in that plan. It was not to be implemented in 30 days. I don't believe, that is not what I believed I was voting on, okay? That was not what I was assuming I was voting on. And we was approving the plan. There's nothing wrong with the plan. I do think that the implementation date was not determined.
Well, as I
I don't know that we were approving the plan as much as we were accepting the report.
Correct, on that one, Roger.
This is Reverend Emerson. After much discussion, we really agreed to accept the plan and proposal that was submitted, and that in 30 days we would come back and review and then deal with implementation, what was included in the plan. But we really voted just to accept it and move on.
And my only objection is I know that what the actual motion it was, but I want the whatever's reflected in the minutes to be in the spirit of what we discussed, which is what Reverend Emerson just said. It's not to cause a wrench or cause a problem. It's just to make sure the record reflects the spirit of our discussion, even though the motion that was stated by Dr. Weber was to accept the report with implementation after 30 days. And I think that we still have some pieces per our discussion to discuss before we implement.
Folks, I agree that we need to have discussion. What I've got on the table right now is approval of the minutes of the meeting. And if you folks are not okay with that, Neil, I'll need your guidance on what we do with it.
Well, you got to have a second one.
And we don't have that apparently.
Right. And so unless somebody,
No,
Ralph,
I'm sorry.
he has the right to indicate if he wants to modify what's reflected in the minutes. If there's objection to what Ralph is proposing, then there would be a vote of the board. It would be a vote who voted for the motion originally, and there were 10 of you. Roger voted no, so it would be if Ralph indicates a modification to the minutes, then there's a vote of the 10, and a majority of that 10 would control. If the majority votes to accept Ralph's correction, then you vote on the minutes as corrected.
I understood, and Dorothy Roy is the one who made the motion, so whatever she says to me matters, and I'll follow. But I thought we were delaying implementation because of the crisis at hand. It wasn't that we didn't agree with it, the plan or the implementation of it. We just wanted to defer it for 30 days while the crisis at hand was being tended to.
That is my understanding.
Neil, legal question. If Ralph's comments are a motion to amend where the report was accepted, is what I'm hearing him saying, implementation to follow, that implementation hasn't truly been determined yet. If that's a motion to amend the minutes,
Correct.
Would that need a second and a vote?
A motion to correct the minutes, not amend. Correct.
Okay, to correct, if it's a correction, then would Ralph's motion to correct, would that take a vote now also?
If nobody objects, it doesn't require a vote. But if somebody out of the 10 votes, the other 9 votes that voted for the original motion object, then there has to be a vote on that, on his correction. If nobody objects, then you go ahead and approve the minutes with the correction under Robert's rules.
All right, then I'll make a motion to revise the minutes to reflect the Reverend's direction.
Let's make sure that we have this wording perfectly clear so we don't have to go through this next month. Reverend, what exactly is your motion?
Well, actually, Dorothy, really, Steve is correct. Dorothy actually made the motion. What I was just referring to is that understanding was that the motion we made, because there was so much discussion. Pardon me? Okay. Actually, my understanding was that the motion was to accept the report as presented, because we didn't really make a lot of changes or adjustments in the report. We just accepted the report, and then we would hold it until we had another month to all of the COVID-19 settle down, and then we would go forth and take action toward implementation.
Do you want to state your motion?
So are we saying that's my motion?
Ralph? Hello, Ralph.
That we accepted the report as it was presented after much discussion, and that we would hold any implementation until after we got through the COVID-19 or for 30 days.
Okay, is everybody okay with the motion so we don't have to vote?
I just think we need to take the 30 days out of it.
Correct, I agree.
Well, the 30 days was part of the motion, though. I mean, that was an accurate reflection of what was said. Wait for 30 days. So I don't know how we take that out.
Well, 30 days passed.
That's true.
And so all we're trying to do is reflect in the minutes what the intent was of the board. And the intent of the board was to accept the plan and to defer any action until after everything had settled down with COVID-19.
Well, no, we said 30 days. COVID-19 might be here for 5 years, guys. I think that's so open-ended. That's not what we discussed. We said we're going to wait 30 days. We're trying to reflect what we actually did last time, not what we want to do going forward.
We can decide when we're finished with COVID from that standpoint, or we can bring this up again later at the next board meeting. But all we're trying to do right now is to reflect from the minutes accurately what was the intent of the board.
And perhaps Jim and we just disagree on what the intent of the board was. From my understanding of the motion was, we're going to accept a report, we're going to defer action on it for 30 days. 30 days has passed. So it could be read as, let's implement it, because we've waited 30 days.
I think that, okay.
I still believe that go ahead, Dorothy.
Believe that even if you leave the 30 days in there, you cannot implement that plan without bringing it back. There are some things in that plan that is not really outlined that for us to implement. Number one is, what are we paying for that service? That's not in there. That is not something the board has been approached on. So even after 30 days, I believe we would still have to come back with some definite things in there. I agree to the plan, but there are some things in the plan that I also want to question. Okay.
Makes no sense.
I'm gonna use some chairman prerogative here. The implementation to begin after 30 days doesn't say we're going to do it right away after 30 days. It just means that we're going to wait. It doesn't say that we're going to implement it. It just says sometime after 30 days we're going to look at it, recognizing that it's a very controversial issue, and we're going to be back looking at it again. No question. What I need to do to move this meeting on is I need to have a second for the minutes, or somebody make a motion to change these minutes so we can vote and move on.
Can I say that we can leave the minutes, but the 30 days from the date of April 9th, to me, should not be in there. We did not say anything about implementation days from April the 9th.
Well, we did say 30 days.
That's all you need to say is 30 days.
Well, the way I read it, it actually doesn't say in 30 days. It says after 30 days, which could be 40, 60, 90, 120.
Yeah.
Yeah.
Neil, do you have a comment on that?
Again, it comes back to the intent of each individual board members in terms of their discussion and what they remember in those discussions. And how it's reflected here will be determined by the majority of the 10 of you. Actually, it will be determined by a majority of the 10 who voted for the motion. The only one that cannot, if the minutes are corrected and somebody objects to that correction, then the 10 people who voted for the motion, there would be a motion to, by the chair, be a call for a vote on the motion to correct the minutes as suggested. If that passes by a majority, then the minutes are corrected. Mr. Fisher does not have a vote on that motion. He voted no, original motion.
Okay, Neil, so explain to me exactly where we are, if you would.
I'm not sure I know either.
Well, Neil, the way this is written does not mean that we implement this in 30 days. It says after 30 days, which is open-ended the way I interpret it.
If you remove from the April 9th date out of there.
Agreed.
Okay, so you folks want to amend the minutes to just remove the date of April 9th, 2020?
Then the question, Mr. Chairman,
From
is,
the 30 days.
the question, Mr. Chairman,
sorry,
then you
I'm
have
in the
to
middle of a board
ask
meeting.
out of the 10 who voted for the original motion on April the 9th, is there anyone objects to that correction? If not, then the minutes will be modified by taking April the 9th, 2020 out of it, and you will vote on the minutes as corrected. If somebody objects to that removal, then you have to vote on that correction, and the majority of 10 will determine whether that correction stands.
Okay, does anybody object to removing the date of April 9th, 2020 from the minutes? I don't hear any objections, so then.
Chuck, this is Zim.
Yes.
I guess I don't object as long as we understand that implementation doesn't mean implementation of the plan as written. That's where I got a heartburn.
Okay, I believe I understand where everybody's coming from, but it's now down to a procedural thing on what we put in the minutes.
Right now, you don't have an objection to correction. So if you don't have an objection, then you vote on the minutes as corrected, which means the minutes would be approved with this one item, removing the reference to the date of April 9, 2020. That's what you are, Mr. Chairman.
Okay, and Ralph, you made that motion, or did Dorothy?
Dorothy made the motion and Steve Montgomery seconded.
Okay, then, all in favor, please say aye. Those opposed, same sign.
What if we did?
All right. Go ahead, I'm sorry.
Suzanne is looking for somebody, if anybody voted no on the motion.
I didn't hear any no's.
I did not. Okay.
All right, let me get back to my minutes here. Board chair report. I don't have one, except once again to say thank you for everybody that's doing the work that they're doing. Robert will have a much more detailed report from everything that's been going on. So Robert, you're up.
Thank you, Mr. Chair. I appreciate it. If you all want, and I'm happy to talk to you all tomorrow and give you a daily update tomorrow, but this well could serve for our weekly update since we have a board meeting. But if you do want to talk tomorrow, I'll be happy to have the call with you as we give just informational update to you all on.
So
Oh, Lord.
Uh,
There's a mute button.
I hear perfection.
Chuck, there's a mute button on your screen.
Our census today is at 69 patients. And that, if you all remember from our discussions of last week, is down. We hovered last week between 76 and 81 patients. Our high was 81. And that was primarily due to about 50% of our patients due to the federal prison. Our amount of inmates coming from the federal prison has been reduced significantly. We are seeing a change in the amount of patients that are coming from the federal prison, and that has been very, very helpful to us dealing with our population. We have 69 patients, as I mentioned, and that is probably larger than any other hospital in Tarrant County. My colleagues do not have numbers that rival that. I think the one closest to that, at least as of yesterday, was THR, and they were in the 30s, and everybody else declines from there. We have 19 patients currently in our ICU. I just got a quick note that we may be up to 72 patients, but we have 19 patients in the ICU. We have totally tested, we have tested 2,000 people at this point. Those are inmates, those are employees, and those are people that present at the hospital. Of those 2,000, a little bit over 2,000, 400 have tested positive. We have tested 500 employees. Of those 500 employees, 40 of those have tested positive. So that's just an update that I provide you all that gives you just the statistical information about JPS. I want to now move on, unless you all have questions about our census, I want to move on to some of the things that we've been doing in the last time since we saw you as board members and at our last board meeting. We are moving forward with elective surgery. Now, Michael Hochberg and our clinical team, we have a clinical committee that's looking at these issues, have been doing this incredibly intelligent, in my opinion. They have gone slow, they have gone methodical, they have been pragmatic. We have not been able to open up elective surgeries from the standpoint that if we opened up elective surgeries, our numbers were climbing. Couldn't do that. We put our PPE at risk. We put our testing platforms at risk. Now that our numbers have declined a bit, it makes it a more reasonable situation. We feel confident with what we are able to do in testing because everybody that comes in for elective surgery will be tested for COVID-19. We are only at this point going to be dealing with low risk. And what we mean by a low risk procedure, it will be those not requiring hospitalization. And those cases will be less than, or presumably less than 120 minutes. So we are taking the lowest risk. Again, all will be tested prior to COVID, prior to their surgery for COVID-19. I've talked to our colleagues at Baylor and THR and Medical City who have all already started their elective surgeries, and they are very, very low in their percentage of people that are testing positive that are coming in for surgeries. In fact, I don't mean to misrepresent my colleagues, but from the call that I had with them yesterday, it's hovering at less than 1% of the people that come in to receive their elective surgeries. Less than 1% are testing positive. We have a backlog of about 500 cases. We have the challenges that we face with those that are dealing with pain challenges, dealing with the need for injections and other things to deal with hips and back pain and other challenges that they have. Also, the longer we put off having our folks be in elective surgeries, the more challenge we're going to have as we go forward when we begin to really fully come back online. So I applaud our medical team. I applaud Michael Hochberg and Karen Duncan for all their hard work, Wanda and Deb Saunders in our OR, just an incredible group of people who have really meticulously thought this through. So we are looking at around May 26th for doing that. We have a lot of things to get into place between then and now. And the cautionary comment that I would have for y'all, if our numbers and our census of COVID-19 patients increase, then that's going to be a challenge, which would then delay our elective surgeries. We are going to look at it, put that low risk patient population in at a small level, and we will begin to ramp that up accordingly as our census continues to go the way we hope it goes, and we make sure that we have the proper amount of PPE and the proper capabilities that Janet Miles has in our lab to do our testing. So it's a very, very thought out and very, very methodical. So the other thing I wanted to update you on is the efforts that Dr. Jerry Henderson and David Mendenhall will be taking, primarily to David Mendenhall, dealing with House Bill 3834. House Bill 3834 was passed by the legislature the last session, and it speaks to cybersecurity, and it speaks to the training that is needed for all of our employees for cybersecurity. It applies to all state agencies and all state employees, and it also applies to all county hospitals and all county hospital employees. Our responsibility is twofold. One, to inform the board, which I'm informing you that we are adhering to the guidelines of House Bill 3834. And secondly, we will be implementing a high-level training program starting on June 1. We will update the governance committee and give them updates on all of our cybersecurity training that we will be having when we have the next governance committee. The good news for you as board members, and why you can now take a different view of House Bill 3834, it does not apply to you. It will apply to a training program for all of our employees. You can hit the button on your screen that says applause, because you do not have to go through the training. We will be happy to update you, and we'll be happy to have you go through the training if you really, really want to, but you are not required by the law to do so. The last thing I wanted to update you on is something that is near and dear to my heart, and I have given you all in our weekly updates some of my philosophy towards this. We have 7,200 incredible people that Chuck Weber just thanked for all their hard work. I can't find a person in this organization that is not giving COVID-19 their full attention, their power. And at the same time they give it their attention, we also deal with stroke and heart attacks and trauma and everything else that was into our facility prior to COVID-19. COVID-19 has changed our lives. I sent a letter out to all of our employees yesterday because I think our employees need two things. They need to know that we're doing everything that we can to keep them safe. We're providing them the proper equipment. We're providing them the proper gear to stay safe. We're putting up screening methods and everything that we can possibly do to keep our employees safe. I think the other thing that our employees need to know is that we all collectively think very highly of them and their paychecks and their workplace. I do not want to be in a situation where you as a board look at us and say, why did we lose so many employees? What is our retention? How are we going to bring on all these employees because we lost so many? So in my letter, I told them, and I will be giving you all a copy of the letter, I told employees that at this time, it was certainly not my intention and the belief that I've got from you as board members that JPS not implement layoffs and furloughs. I think our employees need that security. We're living in a world where normal left us, and we all seek some level of normalcy. I want for us as an organization to be able to tell our employees, we believe in the culture that you as employees have implemented, you as the board have helped put into place. And we as the administration have tirelessly worked to make sure that we have the proper culture. And I want to reward people that work here. They are working hard. We have flybys and we have billboards and we have people thanking healthcare and frontline responders and first responders and everything in between. Well, I want to do something empirical. And I want to say, I want to give you the security to know that we're going to do everything to keep you safe health-wise and keep you safe employment-wise. Means a lot to me. I couldn't work for a better board and I couldn't work for better employees. And I think now's the time we show employees how much we care for them and how much this organization appreciates them. So I told them in the letter that unfortunately, COVID is not giving us answers. It's not like a hurricane that is a natural disaster that has its attack and it has its recovery. We don't know when recovery is coming. We don't know when we can wipe our brows and say, the vaccine is here and we are done and we are moving on. But we need to give the most security we possibly can. So I will be sending that letter out to y'all, but I wanted to publicly let those who are listening to any of our live streaming and anybody in the community understand the strength of JPS is the people that work at JPS. And so I want them to know how much we care about them. So, Mr. Chair, that is the report that I have for you all.
Mr. Chair?
Yes, sir.
Two things. One is I want to just compliment and commend our CEO on his heart and thoughtfulness for the operation and employees at JPS. That decision that he and staff has made really represents a major move in the community with so many individuals at this point unemployed or have just total jobs. And I think that's to be commended that we're stepping out in that sacrifice. I agree with next day, but at least the position that they've taken thus far, I just want to personally commend them and their heart for. Okay. I just want to commend Robert and staff for the effort that they've made in reference to this and the employees at JPS. This goes a long way in the community.
Good. I agree with you. Anybody else?
Pastor, I appreciate you as board members. You understand what we're going through, and that's why I work for the best board you could work for. Thank you all.
Anybody else? Comments, questions for Robert? All righty. Next I have is...
I have one other item, Mr. Chair.
Yes, sir.
I have one other item to ask Robert.
Yes, please go.
Just seeing on the news, okay, or impact, or I don't know what the question asked, in reference to the testing at the Federal Medical Center, because I thought that they had, well, I used to do chaplaincy at the Federal Medical Center, and they had their basic medical staff over there. So what, are we involved anywhere in the testing of those employees or not? It seems to be kind of a ruckus now. I just wondered, is it touching us?
A couple things, Pastor. I think I know your question, and that is some of the challenge that unfortunately the federal going through. They had over 600 positive cases. Now, a lot of those cases, thank goodness, are going to go away because they're in their 2-week period of time and they're still asymptomatic. But where the relationship is under contract, we are their hospital. So when the prison needs anybody in need of hospitalization, they will first and foremost come to JPS. And we appreciate that. federal prison. And we are fortunate to have them as partners, and we work really well with them. This obviously is a challenge for them, and it certainly was a challenge for us with the amount of patients we were getting. Their medical team is provided contractually by the University of North Texas Health Science, and they provide their medical team. Just like we provide all the medical care for our county jail, UNT Health Science Center provides medical for them. We just serve them in the capacity of hospitalization. So the testing is not done. We do not test. We're doing the best we can. All want advice and counsel from us. We're happy to provide it, but all we do is do their hospitalization for them. So the challenges that they're facing certainly is
Okay. All right.
all the testing is done by.
Okay.
Any further comments, Ralph?
I'm good. I'm finished.
I think, Chuck, I think Amanda had a comment. I think that might have been Amanda's voice. I don't know.
Yes, yeah, that was my voice. Thank you.
Okay.
I just had a quick comment because I think that this is an important part of kind of the changes that have been happening with JPS and being able to allow patients on the virtual doc and the telemedicine portion of that, and letting our patient members, our connection members understand and know that that's an available option to them from this time. So I want to commend staff members, IT staff, all of the doctors, and everybody who is involved in all pieces, but also in particular for that virtual telemedicine option. I think that that's important for our community, and looking forward to, as we're going to expand out that telemedicine, to make sure that it's covering all different languages as well.
You bet. And Amanda, we did something that I think was brilliant on behalf of our communications department. We sent out a brochure to all of our connection patients throughout the county, and we let them know of services that they may not be aware of, such as our telemedicine program, such as mail order for pharmacy. Let them know that we do have clinics open. We are here. We are available to. And you were helpful in that regard. We had a reference in there, our major, which is we sent it out in English. We have a reference at this point. Go to the website, which has Vietnamese and has it in Spanish. But that mailer that went out last week, I think, will be helpful communicating the new situation that we face, how we do it. And I think this board in the future will have to deal with telehealth and how we cope with that, because it's going to make a difference. You know, we do have a facility fee, and that facility fee does have an impact to us. To some, it's cumbersome and it's a challenge. It represents a challenge with the commercial payer, but it also does deal with the line JPS. Telehealth would be a divergence of that difference, and so we need to look at the financial implications of it and how we deal with it, but the convenience and how we now look at the world and what we present to our patients. COVID-19, once we get rid of it, will have pluses actually in how we do business. It'll change business, I feel, in some cases for the better once we get rid of its now. But thank you, Amanda, for your comments.
Anybody else? Comments, questions for Robert? Okay, item 7 on the agenda, report from the Medical Executive Staff Committee requiring discussion, updates, deliberations, actions, and/or approval. Is Cheryl there? Okay.
Yes, sir, Chair. I'm here. Thank you. Actually, we have just a few, actually just 3 items up for discussion. And since they're all approvals of changes in leadership, would it be okay if I offered a motion to accept all 3 together?
Go to Neil for that one.
No, you're going to have a separate motion on each one in the vote. Sorry.
Just one. Okay. So the first motion, which was presented to the Medical Executive Committee, which did approve consideration of the change in anesthesia leadership for Irving Ward to become the chair and Robert Fromm to become the vice chair. And as per the bylaws, the department did have a vote in that regard before sending it to the Medical Executive Committee that approved
Somebody
it.
like to make a motion for approval?
Mr. Chairman, if that's a motion, I'll second it. This is Charlie.
Okay. Any further discussion for Cheryl? Anybody that wants to vote no, please say so. Okay, item B, Cheryl.
Okay, my second motion is to consider approval, for approval of the change in leadership in the Department of Obstetrics and Gynaecology for Dr. Rupina Sangha to become chair and Dr. Stephanie Carson Henderson to become vice chair. Again, as per our bylaws, there was a vote in the department for these changes that were then submitted to Medical Executive Committee, which did approve these changes to be submitted to the board.
Is there a second?
I'll second the motion. Steve Simmons here.
Okay, there's a second. Anybody opposed, please? Pardon me? I got you, Steve. Anybody opposed, please say so. Okay, Cheryl C. Surgery.
All right. Final motion is approval of the change in leadership of the Department of Surgery for Dr. Rich Miller to become chair and Dr. Raj Gandhi become vice chair. Again, as per bylaws, there was a departmental vote before sending to the Med Exec Committee, which did approve these changes and recommended to the board.
I'll move to second.
Okay, second. Anybody opposed, please say so. It passes, Cheryl. Thank you for all three.
Thank you.
Okay.
Thank you. That's all I have right now.
Is consider acceptance of March 2020 unaudited financial report. Sharon Clark, ma'am, you're up.
Hi, good afternoon.
Good afternoon.
Can you hear me?
I can hear you.
So I'm going to cover our March numbers today, and then I'd like to give a few remarks about what has been happening in April. Just so you know, we are just now getting the April financials closed. So we're going to have to back it all the way up to March. And if you recall, our closures and all of the stay-at-home orders began happening kind of mid-month in March, mid to late March. So I'm going to start to share my screen with you guys. This is new for me. So where's my PowerPoint? There it is. I'm better with the one I'm familiar with. I got it. Thank you.
All right.
That's why I come to work, so people can look at me and tell me what to do here. So I'm going to make this bigger. All right. So if you start to look at our statistics, they were not greatly impacted in March. We were about 3% down on the admissions. As you can see, our case mix index has remained high pretty much all year. Our patients are more severe, and we've been doing a great job with length of stay and holding that down. On our emergency department visits, that was hit significantly those last couple of weeks. We were actually below budget, 11%. And you can see we were just slightly, probably the lowest that we had been all year. It was not a huge dip, but it was a noticeable impact. Our urgent care felt a bit more of a hit. You can see that they were almost 30% behind the budget for the month right there. Our primary care visits were extremely impacted. If you recall, we did go in and consolidate a lot of those clinics because the schools had closed. We actually went in and closed the school-based clinics temporarily as well. So you can see the big impact, about 40%, on my mouse there, about 40% here for primary compared to the budget. And you can see there was a lesser but still significant impact for specialty clinics. When you look at our surgeries, oh, that didn't click down. Okay, for some reason, my screen is not moving. I think I need some technical assistance here. I'm just gonna leave that screen frozen for a moment and just read from your page here. But when you look at inpatient surgeries, it just went page down here. So when you look at our inpatient surgeries, they're about 12% down, and our outpatient surgeries, which were more, thank you. Which button are you hitting? Okay, all right, I'll stick with that button then. Our outpatient surgeries over here to the bottom right were more significantly impacted at about 37%. Okay, our mental health division, you can see our psych inpatient days were right on budget. Our clinic visits were significantly under, tracking similarly to primary care and specialty, about 30% under. Our PEC was 20% over. There's a lot of correlation between stressful times and staying at home. And our outside medical services usually have a pretty close relationship to what happens in the PEC as our inpatient beds are full and we go out with community partners to find inpatient relief. Days cash on hand has not changed significantly. It's still about 258 as of March 31st. Our net days AR continued to fall. It's at 40 days here. And then you can start to see for the first time in years, we actually had an unfavorable variance of FTEs per APD as we tried to figure out how to manage back to that decreasing volume and all of the special COVID work that continues to happen. A lot of those staff from the clinics have been redeployed for entry checkpoints and other work that has to be done downtown. Our connection enrollment kind of leveled off for the month. We have made some changes to the way you can enroll. Some of the restrictions have been lifted to make it a little bit easier as far as documentation. We're doing a lot of application online, by telephone, by drop-off, and then it's scanned. And that staff, the majority of that staff is also working from home. So when you look down at the March income statement, and we actually just lost a little bit of money, about $250,000 compared to a $6 million budget. And all of that variance sits up here in total operating revenue. The volume impact was about a $5 million impact to that 6.4 million. And the rest was an unfavorable mix as our self-pay volume had kind of spiked in March. Just as a preview to April, it had the opposite effect. We had a very strong payer mix in April with significant lower volume. So, but in March, we had both a lower volume and a negative payer mix. Really the only other thing to note, we did have some big variances here. Purchase service is where our connection professional claims hit when we pay physicians in our community, including those employed by a claim, to see the self-pay and connection patients. So as clinic volumes dropped and other inpatient services were down, there were actually some savings and those claim numbers. Those could rebound when we return to normal work. If you look over towards our year-to-date number, we're still at about 33.7 million compared to a 32.7 million budget. Are there any questions for March for the medical center before I go into a claim? Okay. I'm going to go to the encounter page for a claim. Again, you can mirror from an encounter standpoint. A claim was down about 17%. They've trended around 5 or 6% for the year. So that was a significant decline for them there. And then as you look at that income statement for a claim, again, all the impact is up in the net revenue. As volumes were down 17%, so was the revenue generation. And then you can see that salaries and the total expenses stayed relatively the same, and creating that $1.4 million deficit to the budget. And then their year-to-date number is brought to 16.4. So as we start to look at the consolidated picture, year-to-date, we are getting, we've still got about we've just come to about a $2 million underage from income from operations with the combined activity for the system compared to a $20 million budgeted income.
Sharon, I think Roger has a question, but he's having some difficulty with unmuting himself.
David, can you help with the muting process?
Thank you.
Roger, you're good.
Thank you from the WebEx overlords. I can't, with the screen share, I can't get off of unmute. So, and I raised my hands, I guess. Sharon, I know it's difficult, and certainly in this time to look at budgets and budget cuts and departments, but has there been a request of departments to say, hey, trim 5% off your budget, trim 10% off your budget? Have we gone there yet?
We have gone to departments to ask them to stop all unnecessary expenditures or any expenditures that can be stopped. We have looked at capital expenses immediately and halted most of those unless they are critical or patient safety items. We are looking at all expenses, including the way that we are staffing. Because of COVID, there has been a lot of additional expenses that have gotten added to our normal work. Some of those I've mentioned, but even staffing some of those more critical patients, we've opened up a new unit. The staffing is even higher in those units as those patients progress. So we have done a good job with expense control, especially like thinking, kind of giving you a preview towards April. Our claims expense continue to be low. Medical supplies are tracking down because surgeries are very intensive when you look at the supply number. And we had done a much better job staffing, but you're not going to see the same ratios immediately. And Robert alluded to a little bit of that. We are trying to get creative with staffing pools. So if you happen to be impacted by some of the lower volumes, it's a temporary pool where you can call in and you can get redeployed to an area that is having some staff shortages.
Okay. Can you give us a kind of a rough plus minus on what we've spent? I know we can't deal with patient volume and whatever, but extra beds, extra ventilators, whatever, those additional expenses versus what we've been reimbursed thus far to date from the federal government?
So what we've spent is a bigger question, and how to capture and what is actually allowable in some of those expenses. In April, the dollars that we get are very clear. Based on the CARES Act, there were 2 tranches that went out. One was very quick, and we had no idea when it was coming. It just hit our bank account. That one was for $6.7 million. And a few weeks later, they had the second tranche, which kind of right-sized everyone's allocation based on their total net patient revenue. So what you expect to collect from patient activity. So the second payment for us was 1.8 million. So a total of 8.1 million gets recorded in April. So April's a really big month, right? Because that payment is not just for March and April. That payment may be the last big CARES Act money that we are allocated, regardless of how long the pandemic and its effects may last.
Okay.
So what we've spent so far to date, just in special PPE, I would estimate that at close to $3.5 million. The biggest part of that was a huge order for masks. We also had to get in some emergency management beds, which you approved last month. And then, we are just going through very difficult times in sourcing and getting supplies that we need. We didn't always use this many masks, obviously. So we can get the masks that we were historically purchasing, but we've tripled or quadrupled those quantities on a weekly basis. And you're really going out to supply and demand and paying an incredibly higher amount. Things that might have cost us a nickel before COVID might be costing us close to $1 today, and we're utilizing them 10 times more. So those are items that we are trying to calculate. There's all the opportunity costs that COVID brings with it, and lost dollars and lower volume.
Okay. Thank you very much.
You bet. Does anybody else have any questions? I'm going to give a moment of silence so I can see you. There's DT.
DT.
DT, I don't think your mic's on. I can't hear you. I can't hear you.
I can't hear him either.
Yeah, his mic is on.
I can hear you.
Yeah, he is unmuted.
Okay. I can't hear.
DT, I think you've got your headphones plugged in.
Oh. And now he's muted. There he goes. Oh no, he's dialing in. Okay. While DT gets dialed in, is there anyone else that might have a question?
There's Neil.
So when DT is dialing in, I can give you guys a little update of what the full impact of the month of April is on just the volumes. Our admissions are down by about 15%. The acuity is much higher at 13%. Our ED ended up being about 30% under, and our primary and specialty clinics were 90 and 80% behind budget for the month. So some very significant impacts during the 4 weeks of April. DT, are you back on?
Yes, I am. My question is around the grant. Is that grant or is that loan, forgiven loan? And is there any restriction or advancement that we need to up down the road? for that
Are you
8.1
talking
million?
about the Medicare advanced payment?
So it is a advance that we have to chew up down the road.
Yes, sir. That cash was received, but it will not have a financial impact for JPS. It's really just forwarding money. And then I look at it similar to like a cost report or even a tax return, where they will look at the activity for the next 6 months, and then that amount will have to be repaid or will be recouped during the year.
Right.
Sharon, clear. I think you might have some confusion with DT's question and what the board. You're reporting that we've got a little over $8 million in overall stimulus money. I think DT's question is, of that money, how much is it repaid, that needs to be repaid, and how much of that money has requirements on how it's spent? So I don't want the board thinking that all $8 million of that money has to be repaid to the federal
Right.
government.
So thank you, Robert. Let me kind of start over. There are two large cash transactions that are happening for relief. One is the CARES Act that I talked about recently, where we received $8.1 million. That is true income for JPS, and we're not sure, but at this point, it is not indicated that there will be a reconciliation for that. That is a gift of money of $8 million, and you will see that impacting our income statement in April. The second question that I was trying to answer is another cash windfall, but it's temporary, and that's a Medicare advance payment. Those payments are, they look to see what you would have received under your normal Medicare payments, and they front load that to you for about 6 months worth of payments. And then they give you that cash to help you through these times. And that payment is the one that actually has to get reconciled. We don't recognize that cash as income until we actually earn it by seeing Medicare patients. So that amount, which we have received, will definitely have to be reconciled. There is talk, and I stress talk, that there are some people who are promoting that the Medicare advance payment actually be gifted and not have to be returned or reconciled in the future, but that has not been approved. So there's a lot of effort to try to make sure that that happens. Does that answer everyone's question?
Yes.
Okay. And you know, maybe by the finance committee, if we have it next month or at the next board meeting, we'll have a clearer picture on all of the monies that we may be entitled to.
All righty. Any other questions, comments for Sharon on the financials? We need to have approve these.
Mr. Chairman, this is okay.
Sorry. I have a quick question on, I know these are the 20 March number for JPS enrollment. Do we expect a big jump in unemployment if it's so high for April or May? What is your take on that?
So I think I got about 60% of your question. So I'm going to repeat it, and then you can tell me if I've got most of it correct. The impact of the unemployment that might be coming up later in later months, is that kind of the basis of your question, and the impact that it might have to JPS?
Right, because I think they are, most of the people that file for unemployment may be covered or in between COBRA at this point. But at some point, we'll reflect on when do you project that will be our enrollment is going to increase, and do we have staffing to take care of that enrollment?
So enrollment and eligibility, I have been talking with Michelle Haynes, who most of you have met. She usually comes and gives a presentation every 12 to 18 months on how we get people signed up for the Connection program. Again, as I mentioned earlier, we really looked at those processes and tried to make sure that we could make it as easy as possible during the social distancing for people to get signed up and in our system. They are gearing up for that. We do have some open positions. We're trying to fill those, so we are ready. And you know, when you start to think about what keeps me up at night, it's not the impact that we're seeing today. It's not what we went through in April or might happen in May and June. It's really that lasting impact of the resources that might be required for Tarrant County's unemployed that could last for 24, 36 months. So DT, we have anticipated an increased need there, and we hope that we will be ready when that comes. We've seen a slight uptick in applications being processed, but and they have noticed a slight increase in the number of telephone calls.
Thank you. All righty. Any other questions, comments for Sharon?
Mr. Chairman, I move that we adopt the report as presented by Sharon from the March financials.
I would second it, Mr. Chairman.
Who is that? Is that Charlie?
This is Charlie.
Okay, second by Charlie. Anybody opposed, please say so. All right, it carries. You're up again. Restatement of JPS pension plan and amendments. Sharon.
Yes, I'm your presenter for the next 105 motions here today. So bear with me. I'll try to make sure people don't have questions, but please interrupt me if I don't see someone. So we are on item 8B1, and there are 4 resolutions here that impact one of our employee benefits as far as the retirement and the pension plan. The first 2 are very different, and the second 2 are intertwined. So if we can start with the resolution authorizing the amendment of the JPS plan under B1. At the February 13th board meeting, which seems very long ago, we discussed actually precluding entry to the current pension plan and redesigning a retirement benefit more in the defined contribution for employees hired on or after October 1 of 2020. This resolution, in the printed book, it's on page 38. But this resolution is adopting that formally. After the February 13th discussion, we have communicated that to the current employees who are not actually impacted by this change. And so that rollout has already happened. This resolution will document that in the formal pension plan itself.
Any questions, comments for Sharon on this part? We'll need a motion for approval.
This is Dorothy DeBose, and I move approval for the resolution authorizing the amendment of the JPS pension plan.
All right, is there a second?
A second, this DT.
Any further discussion? Those opposed, please say so. Other than that, the motion passes. Sharon, keep going.
Thank you. Under item B2, this is a resolution that is required every 6 years. We make amendments, small amendments throughout the process of the last 6 years, and we are required to maintain favorable qualification under the Internal Revenue Code to clean up that document and to mesh those amendments in so you have a fresh, clean pension document. And that is what this is actually doing. So I do need a motion to continuously update. It will include the motion that just occurred.
approve the amendment for the to the JPS pension plan. Okay.
This is Jim. I'll second.
Or actually, Dorothy, it's a restatement of the pension plan.
All right. Move the restatement of the pension plan. Okay.
Okay.
Sam, you gonna second that?
Yes, I will.
Okay. Any discussion? Anybody opposed? Please say so. Motion passes. Okay, Sharon.
Okay, so I'm going to tell you about items B3 and B4, and then we can move on them independently. Every 3 years, we have a contract with our current provider's Prudential for all of our plans, both our 403B as well as the 457 and our supplemental plan. Years ago, when we had begun the physician network component, what was previously Acclaim, and the medical center had 2 different plans. They each had those 3 plans, but they were organized very differently. Over the last 15 years, those plans have become identical and they're administered exactly the same, but we have 6 separate plans. We have the supplemental retirement, the 403B, and the 457 for both the JPS hospital as well as the Acclaim Physician Network. Because our contract is up this year, we are wanting to combine those 6 plans into 3 plans. It does not save actual money for JPS, but what this will do is it actually reduces the fees that our members are charged. So the employees will save this money. If you look at the proposal on B3, this is for the JPS Health Network side. B4 is going to be from the Acclaim Physician Group side, and both of those have to occur. B3 has 4 items on it. We are renaming the supplemental retirement to a 401A plan. Then we are saying that the Acclaim supplemental will go to the JPS 401A plan. Also, the Acclaim 403B will merge with the JPS 403B, and the Acclaim 457 will merge with the JPS 457. So I'm looking for a motion on those 4 items under the resolution under B3.
Is there a motion for approval?
Reverend Emerson, so moved.
Is there a second?
I'll second. Go ahead.
Suzanne sounded like it was second by Zim.
Zim, yeah.
Gotcha.
Any further discussion? Anybody opposed? Please say so. Motion passes. Okay, Sharon.
Okay, so the resolution on B4 has 3 items. It is approving from the Acclaim Physician Group for Acclaim supplemental to go into the JPS 401A, the Acclaim 403B to JPS 403B, and Acclaim 457 to get merged into the JPS 457.
Question for Sharon?
I have a quick question. When you merge the Acclaim into the JPS, is that going to affect the mean test that we're going to be having?
I'm sorry. Will that impact the what?
The mean, once a year we have to do the mean test to make sure the fairness of the plan. Is that going to change drastically from the current plan that we have when we add this in?
I don't anticipate that the discrimination testing would be impacted by this.
All right, thank you.
Anybody else? Comments, question for Sharon? If not, need approval.
This is Zim. I move to approve.
Is there a second?
Second by DT. Second by DT.
All righty. Anybody opposed? Please say so. Okay, it passes. Sharon?
Right. Okay, so the next few items are contracts. These would have been contracts that would be presented at Finance Committee, but because that was canceled, we are requesting that these get approved by the full board here today. The first one is item 8C. It is with Scott and White Health Plan. This is actually my contract, and I'm very excited by this. We have been talking to Scott and White for the last 5 years, and this will allow us to bring in their commercial plans, their Medicare Advantage, as well as their Medicaid plans. There's about 11,000 members right now in Tarrant County for these Scott and White Health plans. So I'm requesting approval to accept this managed care contract.
Comments for Sharon? Approval by DT. Is there a second?
Second, Steve Simmons.
Thank
Any
you.
further discussion? Anybody opposed? Hearing none, motion passes. Okay, Sharon.
Okay, we are moving on to item 8D. This is with RPNT Acute Services. As you know, we actually perform all of the healthcare related to inmates. And this is for dialysis that would have been on an outpatient basis, but this company actually goes in and performs that dialysis in the jail or prison. This is a 3-year contract for $715,000. It was an exception to bid based on nursing services. And they are the only one vendor that we're aware of that would actually go into the jail and perform these services for inmates.
Question for Sharon? Need a motion to approve, please. I don't hear any. DT, motion to approve. Is there a second?
This is Zim. I'll second.
Second. Any further thoughts for Sharon? Anybody opposed? Please say so. It passes. Okay, Sharon.
Okay, we are on item 8E with the UNT Health Science Center for Library Services. This is a 3-year contract for $929,000. This is a renewal of a contract. We've been using them for about the last 3 years under this capacity. It was decided years ago, based on the increased cost for us to actually become electronic, that this was a collaboration tool that we could use. And it has increased utilization and outcomes. And there's a unique direct point of care at the bedside where a librarian rounds with the clinical team. And that has proved to be a big success. If we were to try to do something similar on our own, it would cost us about twice this much. So again, this is a 3-year term for about $929,000 over those 3 years.
Comments for Sharon?
Move approval.
Second.
Just second, Steve?
Charlie.
Either or.
Either or.
Either or. Suzanne, call it Steve. Any further talk or discussion for Sharon? Anybody opposed, please say so. Motion passes. Okay, Sharon.
Okay, we're on item 8F. This is also with the UNT Health Science Center for CME. Again, this is an interlocal agreement. It's a total cost of 3 years for about just over $600,000. This allows us to provide continuing medical education and also leads to the high quality patient care and learning, especially from our residents. So This is again for 3 years at just over 600,000.
Comments or questions for Sharon?
Move
Hearing
approval.
Who's that? From Steve?
Steve Simmons.
Is there a second?
Second, from Amanda.
For Amanda, any further discussion? Anybody opposed, please say so. Motion passes. Okay, Sharon, G.
Okay, so item G is a contract. This is actually grant award for psychiatric residency. This increases this year from 6 residents to 8. There will be offsetting expenses over this 2-year term, and it's $1,050,000. So we are looking to get this contract approved.
Comments, questions for Sharon? I don't hear any, so.
Move approval.
From Dorothy, is there a second?
Second, DT.
Second from DT. Any further discussion? All in favor? Anybody opposed, please say so. Hearing none, motion passes. Okay, Sharon, H.
8H is a contract with MHMR. It's actually a revenue generating contract. Under our current contract, we have, they lease 28 beds. We call them our LCA beds, or local commitment alternatives. They pay us under that contract about $5.7 million a year to expand the capacity of MHMR and meet their state requirement for beds. They've reached out to us to include an additional 2 beds this year through the state fiscal year that ends August 2020 for an additional $385,000.
Comments, questions for Sharon on that one? Hearing none, somebody make a motion to approve.
Move for approval. That's Charlie.
Is there a second?
Dr. Steve, second.
Any further discussion? Anybody opposed, please say so. Motion passes. On to I.
Okay, 8I is a little different. The city of Fort Worth is putting up a traffic signal in front of the Diamond Hill Clinic. They've agreed to pay us $4,050 for both the permanent easement as well as a temporary easement during construction. This has gone through a fair market value study and is deemed to be reasonable. So we are looking to grant the city of Fort Worth that right-of-way easement.
Any discussion for Sharon? Hearing none.
Move for approval.
Second.
Any further discussion? Hearing none. Anybody opposed? Motion passes. J.
8J is an interlocal agreement to provide medical and patient services from the city of Fort Worth. Back on March 18th, the city opened effectively a center for those experiencing homelessness at the Fort Worth Convention Center. It provided a place for people to go to maintain social distance outside of the shelter, and additional care if COVID or they became a patient under investigation. We did open the shelter. This agreement allows the city of Fort Worth to reimburse costs as defined in the contract, which most of our salary as well as medical supplies to that population at the convention center for an undetermined amount of time until the project is actually closed. Right now, those costs are estimated at about $5,200 a day, but those will be reconciled to actual expenses that are not reimbursed by any other source. So we are looking to for approval on this interlocal agreement with the city of Fort Worth.
Move approval.
Is there a second?
This is Zim, second.
Any discussion for Sharon? Hearing no discussion, those opposed, any say so? Other than that, motion passes. Sharon, you're still up.
Yes, sir. These next few agreements are ratifications. The board chairs were polled for these agreements, and under an emergent basis, they are each going to require an exception to bid for public safety issues because of the timeliness, and then ratification of the chair's approval of these contracts. So
and it would be it'd be a ratification of the exception of the bid as well as the agreement authorizing Robert to sign it on an emergency basis.
Okay. Yes, thank you. So with that,
everybody able to hear Neil?
Yes.
All righty. To have a motion for approval, it will be two parts, one for the exception for bidding and then one for Robert signing the contract.
correct. So for item 9A, this is with a company called Pure Living Limited. One of the very first critical issues that we found ourselves was masks and gowns. You could not find those from traditional sourcing. And so we were able to locate and purchase a one-time purchase for 1.5 million masks, along with some KN95 masks, about 30,000 of those. About a third of this order was done in collaboration with Parkland, and they will be reimbursing us for that. The total purchase price was $702,000. $470,000 of that will remain a JPS expense, and Parkland has already accepted their third of the order and is reimbursing for those. Again, this is for 1 million procedural masks and 30,000 KN95s for a total cost of $702,000.
Comments for Sharon?
This is DT. Do they have a FDA clear, or are they applying? I could not find the company name on the registration with the FDA.
I can link you up with someone in supply chain that will be able to show the documentation, but we do require FDA approval on the PPE that we are purchasing.
Correct.
Yes,
so I don't know if they're operating under a different name, but they were able to supply that for us.
Any other comments, DT?
Is there any way we can find out to see if they have that actual registration form? Because I've seen so many of them stating that they have apply or access, and they have the FDA logo, but there is no chief engineer stamp on it, and it doesn't have the actual stamp from the FDA. I've seen many, many of them. So if we don't have that, I can't vote today.
Let me intervene here, DT. We negotiated the contract. We have that information. Chairman's office has that information, and this product does comply with FDA standards. Okay.
Okay, DT.
Yes, sir.
I mean, that information is not available today, but we have it on file. Sharon can provide that. So.
Any further discussion? We need a two-part motion to approve, if I may.
Mr. Chairman, this is Steve. I'll make two-part motion for the exception to bid and approval of the item.
Thank you. There's
The other Steve,
ratification of it.
Yeah. The other
Steve seconds.
Any further discussion? Anybody opposed?
DT.
DT, you're opposed?
Yes, sir.
Okay. Anybody else? Motion passes. Susan, you got that? I'll have to check with her.
Yes, I have it.
Okay. Sharon?
Okay, we are moving on now to 9B1. This is with a company called Ballister. This is, again, a two-part motion similar to the earlier one. We were able to procure gowns, procedural masks, and KN95 masks. It is a one-time purchase of $61,870.
Any discussion for Sharon? Hearing none, need a motion, two-part motion for approval.
So moved.
Is there a second?
Steve Montgomery, second.
Second. Any further discussion? Anybody opposed? Hearing none, motion passes. Okay, Sharon.
The next one under 9B2 is with a company called Clean Sleep. As we look to try to extend the life of the PPE that is available to us, there's a cleaning process that can actually be performed on the ever elusive N95 masks that are just not available in the marketplace today. This allows us to gather masks from an assigned individual. It goes through a cleaning process and can be cleaned up to 5 times. So you can actually get 5 wears. The same individual wears the masks, but it is cleaned every night and brought back to that individual. So effectively, instead of 1 day's worth of use, we're actually extended each K95 mask to a 5-day use. We've been doing this for about 3 weeks now, and it has been a very smooth process. So this is a 6-month contract for $134,400.
May I have a question? Is this to be, I guess, sanitized through UV and through heating?
Yes.
Or how do
yes.
Can I assume that it's going to UV and then the heating is above 70 degrees Celsius or 167 Fahrenheit compliance?
DT, I don't know at what degree that is performed at. Again, I can get back with you on that, but it has met all of the clinical safety standards. There was an inordinate amount of time with our medical staff specifically going through and getting comfortable with this process. There is another alternative that was here in Tarrant County that was starting up about a week or 2 ago, but they would not allow us to reuse the duckbill masks or the KN95 alternative. So we decided not to go with that other company, but it is being done on a national basis.
Any other thoughts, DT?
No.
Okay, once again, needed to. I'm sorry, go ahead.
Yeah, I'm just concerned because if they don't do it right, too hot, it would disintegrate the filter and all that stuff. So that's why I just want to make sure that it is one of those things that we looked at.
So our
needed. I know that.
Our clinicians that were led by Dr. Stevenson were also involved in this, and we've gotten confirmation that the clinicians as well as national standards this would meet.
Any other comments, DT?
Sure.
We need a 2-part motion to approve, please.
this is Roger. I'll move for the ratification and the exemption.
Okay, is there a
I'll
second?
second.
All right, any discussion? Anybody opposed? Please say so.
Yes, DT.
DT is opposed. Motion passes. Okay, Sharon.
All right, this is our last contract today. It's for a purchase service. It's a company, NB Ventures, also known as GEP. As all of these stresses over the last 4 to 6 weeks have occurred, it was clear before this process that our materials and supply chain may not have been as data-driven or best practice as we would have hoped. With the stresses of the supply shortages, the increased use of supplies, and all of the pretty much 7-day-a-week working, we did see gaps in our ability to keep up with this crisis as it went on. We had also planned over the next 12 months with our new director who started at the end of March to begin some of these processes and make sure that we are utilizing all the electronic methodologies, the supply counts, as well as the direction of the vendors and maximization of the contracts that we did to drive spend. So this contract is for 3 months at a cost of $360,000. And what GEP does is twofold. They actually provide a relief for buyers. There's 5 FTEs that are allowed to us. This firm is working remotely, but as we all are today, that's been a very good collaboration over the last 2 to 3 weeks. And what they'll leave us with is kind of a jump-started best practice plan. So not only are they here to help us during the crisis, but there will be a lasting impact for the changes that have been made. So again, this is a consulting contract for 3 months for a cost of $360,000.
Comments or questions for Sharon? Need a 2-part motion to approve then. I don't hear anybody.
This is Reverend Emerson. I move approval.
Okay. 2 parts though, correct?
Yeah.
Okay, is there a second?
This is Zim, second. Chip. Go ahead.
Okay, any further discussion? Anybody opposed, please say so.
This is Dorothy and I oppose. I'm voting no.
DT also as well.
DT and Dorothy, no, correct?
As well as Amanda.
As well as Amanda.
Mm-hmm.
Okay. Motion passes. We are now up to the report of legal counsel and/or legal matters requiring discussions, which is report of contracts negotiated on behalf of Tarrant County Hospital District that are under $500,000 for the previous month, and that's Neil.
Mr. Chairman, members of the board, in the month of April, there were 48 contracts that were negotiated on behalf of the district under $500,000. I'd like to, on a personal note, some of you or many of you know that I partially closed my office about 3 weeks ago. Well, actually about 6 weeks ago, and then about 2 weeks ago, completely shut it down remotely because I've had 5 of my staff test positive. One of those staff members, Robert, was in the COVID unit for 6 days, and I cannot say enough in her behalf and behalf of the family and my team how incredible that team is. She is home now for 4 days and doing well, and it's because of primarily the care that she got in this hospital. And I can't say enough about that. And the team, the nurses, and the doctors.
We appreciate that, Neil. They are incredible people.
Yep.
Thank you. Thank you for saying that, Neil. I didn't know. I'm praying for you and your folks.
Thank you, buddy.
Yeah, me too.
And they're all five doing well, and been lots of prayers about that. And I thank you for those. I covet those prayers, and I know they do, and their families do. Mr. Chairman, that completes my report.
All righty, then we need to reconvene in executive session. Yes, go ahead.
Chuck,
Yes.
before we move out of that, I just want to make one request. I know that during this time period and the COVID-19, we're not doing bid process in some areas. I would still ask though that the diversity process takes place, whether it's the single vendor or multiple vendors. That record is also included if they are addressing the diversity issues and percentages for JPS.
So Reverend Emerson, this is Sharon. Can I address that for just a
Please.
moment? You would be glad to know that this
Yes,
month
please.
and the contracts that are currently there, unless they are an interlocal, we have gone through that diversity process in full, and not just checked the third box because it was an exception to bid due to any kind of emergency. So there is a contract or two, like with the city of Fort Worth and MHMR, that we did not go through the full process, but for all of those other exception to bid, we did go through and fill those forms out so that those could be included in the minority spend.
No, Ralph, I think that's pretty well ingrained in us.
Yeah.
But thank you for your comments. We have heard you and we are listening. So.
All right, so now we're reconvene in executive session pursuant to Chapter 551 Texas Government Code for the items listed under Article 11, Paragraph A through E, as posted on this board meeting agenda, which is, my understanding is just privileges. So if it's okay with everybody, we'll take about a 2 or 3 minute break.
Okay, Dr. Weber, this is David. We're going to do some switching on our side, and then we'll let you know when we're back in executive session.
you. Pursuant to Article 12 of the posted agenda for this board meeting, the board now reconvenes in open session for deliberation and or action deemed necessary regarding any matter listed on the closed session. And that would be the board will consider the following items: privileges. Cheryl?
Thank you very much. I move to approve the medical staff credentialing and privileging activity as presented to the board in executive session.
I would second that motion, Charlie.
Any discussion? Anybody opposed? Motion passes. How about a motion to adjourn?
So move.
You got it. We're adjourned.
Thank you.
We're adjourned.
Thank you all. Be careful.